Okay, we need to talk about breast cancer because so many people with breast cancer are really hurting. You are really hurting. And I just want to say, I hate breast cancer. This is so frustrating. And I wish I had perfect data to show you and to say 100% of you should do all of these things, that all of you are the same and you should all do X, Y, and Z. But the real problem here is that breast cancer is not all the same thing, and the data is not perfect. And so what I heard recently and has been said, and I think is so lovely, is we are all trying to make perfect decisions with imperfect data. And so while we are treating your breast cancer, you may be noticing low libido, pain with sex, dryness, irritation, and urinary tract infections, because the treatments for breast cancer can really deplete your body of hormones, and your bladder and your vagina need hormones to be lubricated, to be acidic, to fight infection, and to be without pain. And so for us to say you can treat the breast cancer, but you can't deal with the bladder and sexual side effects of the treatments is not only unfair, but it's cruel. And we need to be having more conversations about this. Now, I'm not here to tell you that there is a one-size-fits-all solution, but I'm here to tell you that the data does not support that you can't use vaginal hormones to protect your bladder from the genital and urinary symptoms of menopause and breast cancer therapies. And so this is where you must sit down with a team and have shared decision making where you go over what are the risks, what are the benefits, what do we know, what don't we know? Because I'll tell you, there's a paper that came out in 2024 that looked at a large, like 40,000 breast cancer patients, and those who are on vaginal estrogen had a decreased risk of dying. Okay, so we have data to show that if you use vaginal estrogen, you have a decreased risk of dying, okay? And so we have no data out there, not a single paper to show vaginal estrogen increases death of breast cancer patients. There are two very flawed studies that show women with breast cancer on aromatase inhibitors may have a slight chance of increased recurrence, but no increased risk of mortality. And that's where everyone is afraid. There's no data to show recurrence increase with people on tamoxifen, and there's no data to show increased risk of recurrence in people not on any medicines for breast cancer. So we must be having nuanced conversations that it seems like we need more data. We need more understanding of this, but women are dying of urinary tract infections. Women are getting divorced and their partners are leaving them because there's no intimacy, because it feels like shards of glass in their genitals, and that is not okay. You deserve to live the best life possible. And we make decisions to the best of our ability to say what makes sense for me and my body in this moment of time, because we don't have all the data and we are trying to make perfect decisions with imperfect data. So your cancer doctor is trying so hard to keep you alive, but the question is, are you living the full life that you want to live while making really good decisions for your cancer care? And this is where low-dose vaginal hormones seem to have very little risk, but a lot of benefit. There's so much benefit to allowing you to not have urinary tract infections, allowing you to wear the pants that you want to wear, and potentially allowing for orgasm and intimacy and closeness, which is why so many of us live and enjoy our rich life. And so this is where I beg you to show these videos to your doctors, to sit down with your doctors, to know that your oncologist doesn't examine your vulva. Your oncologist doesn't know all the data about breast cancer and the genito-urinary syndrome of menopause. And we do have guidelines from the Menopause Society and the International Society for the Study of Women's Sexual Health that support the use of vaginal hormones in people with breast cancer, because we have to understand the whole picture here. So I know this is scary and I know that it's confusing, and I am not going to convince you to do or not do something based on a YouTube video, but I want you to know that it is not so clear cut that if you use a vaginal hormone, you will die and get recurrent breast cancer. There's no data to support that. So fear is one thing, right? But we also know that alcohol really does increase your risk of recurrence. Not exercising, not eating enough vegetables will increase your risk of recurrence, and there is no data to show vaginal hormones will increase a chance of death from your breast cancer. So I know this is long-winded, but I just want to say I see you, I hear you. I know how hard this is. I know how you are struggling, and you deserve a team that can look at you specifically and customize care for you, because you matter and your life matters. And we are all going to die, myself included. And so the question becomes, how are we going to live? And how can we let you live your best life in whatever way that looks like for you? So don't give up. Keep fighting for a great life, and let us know what other questions we can answer.